Patients with multiple sclerosis often take disease-modifying drugs and sometimes medications to manage their symptoms. But they also have other lifestyle and unconventional medication interests in their wellness plan. In my experience, it's often best to combine these things and get the best of both worlds, and Dr. Allen Bolling will talk about how patients can use both conventional and unconventional medications in managing their disease.
My name is Dr. Allen Bolling. I'm a neurologist who specializes in MS care. I'm from Denver, Colorado. I'm a physician associate at the Colorado Neurological Institute and a clinical professor of neurology at the University of Colorado. I'm here to talk about a new paradigm in MS care. And my argument in the program today is that I believe our current standard of care actually does not optimize the health of people with MS. And what I mean by that is our current standard of care is generally only inclusive of conventional medical approaches when there are some unconventional approaches for which there's evidence that they could be helpful for people with MS. Also, there are many lifestyle strategies where we have growing evidence that those can provide benefit to people with MS. So our current standard of care in MS generally doesn't include lifestyle strategies and unconventional care. Also, our current treatment approach with MS is very much focused, maybe exclusively focused, on the nervous system and the immune system, but obviously we all have other organs in our body and other functions of the body that often MS care does not take into account. And then finally, and very importantly, our current standard of care is very much focused on disease treatment as opposed to maintaining health and preventing disease. So I'll come back to those in a few minutes, but I want to give you some background as to where I'm coming from. How did I get interested in this topic? Well, I grew up in Colorado, and after high school I left and got all of my education and training, and then nearly 20 years later I returned to Colorado, so this was about 25 years ago. And when I got back to Colorado, I thought, wow, I've got such a gigantic toolbox from all this training I've had. I got a PhD in pharmacology and 3 years of fellowship, and I thought there's really no additional training I could have gotten. And then I must say, within a few weeks of being in full-time clinical practice, I was very humbled, and I felt like I had a very small toolbox because back then my patients were asking me about what diet they should follow, should they exercise or not, should they smoke pot or not, what supplements should they take or should they not take supplements. And all these questions I didn't have answers to. We actually did surveys back then. Our patients back then were actually more devoted to these therapies they were asking me questions about than the prescriptions I was writing for conventional medications. So it felt like there was a real disconnect, and in fact, I have very clear memories back then thinking how there was such a disconnect, and I felt a little like I was driving my physician car and my patients were in their own car, and we would occasionally get in line with each other and we'd occasionally kind of see eye to eye, but it felt like there really were two different paths out there. So that was quite a disturbing feeling. Also, something that struck me back then was when people would ask me the questions that I didn't have the answers to, I would spend a lot of time, so it would take me often weeks to kind of collect research articles to address their questions. And what I found was some of the things people were asking me about could kill people, or they were very dangerous, and I didn't even know that. I had not been trained about those therapies. And then there were other approaches, like very regular physical activity, some particular dietary approaches that same thing, I didn't know the answer to, but when I did the reading and finding out what research we had even back at that point, I thought those should actually be part of the standard of care, and that's not the way that I was trained. So that led me back then to think, well, maybe I don't have the toolbox right now to answer these questions, but I'll use all of the training I've gotten to address these questions and build up a database for MS health professionals and people with MS to figure out how to incorporate lifestyle and unconventional therapies into the conventional treatment plan. So in terms of specific patient examples, this has pretty much been how I practiced MS care through my career. So I've seen people, I've been witness to people over 20 plus years following this approach. And what I've found is the MS diagnosis can motivate people to really take this very broad-based approach, and the cumulative effects of this broad-based approach can be quite striking in terms of not just physical health, but emotional health over time. And in fact, many of my patients spontaneously, and the numbers are in the hundreds, have told me that the MS diagnosis was actually a gift to them because it actually led to improving their overall approach to their body and overall approach to health, and then they saw the cumulative benefits over time. So what I've been leading up to in this talk is the term integrative medicine, and I think a lot of people have heard that term. The general definition that's given is that it refers to using conventional medicine as well as an evidence-based approach to unconventional or alternative medicine, plus adding in lifestyle approaches like diet and exercise. That's a very simplistic definition. It really is not inclusive of what true integrative care is. Two extra elements for integrative care include having a supportive clinician-patient relationship, something that's collaborative. So doing some of these approaches like lifestyle strategies, that's really the accountability for that rests on the individual patient. Prescribing medication, obviously that rests on the clinician, but overall it's a collaborative approach. Also, very importantly, integrative care is focused on treating disease like conventional medication, but it's also focused on maintaining health and trying to prevent disease, not waiting till disease develops to treat it. So I think there's often this talk about the American healthcare system. The way our healthcare system is set up, it's actually a disease care system. You really don't get much time, attention, resources put into your health situation until you develop a disease. Then we try to treat the disease. Obviously, it can be much more satisfying to not even ever develop that disease. So integrative care really has lots of focus on maintaining health and preventing disease. So how do you convert this integrative care model to MS? Like I say, in my opinion, the current standard of care really does not optimize health in people with MS. The current standard of care is to use disease-modifying therapies, the FDA-approved medications to slow down the disease, and then also using conventional medication to treat the symptoms of the disease. So disease-modifying treatment, symptomatic care, that's generally the current standard of care. I would argue there are 5 other elements that really need to be incorporated into the treatment plan for people with MS at the time of diagnosis and from that point forward. And these 5 elements are diet, exercise, emotional health, tobacco and alcohol, and then doing everything we can to keep the rest of the body healthy, or if you have other diseases, to optimally treat those other diseases. So I want to go through those different elements in some detail here. So in terms of diet, I think often there's a tension when you talk about diet to right away think about dietary supplements. The 2 that I would think about, and treatment there can be based on blood level testing, but the 2 I would think about would be vitamin D and vitamin B12. And then there's a very long list, more than 200 supplements to avoid or use with caution because they can have potentially negative effects on MS or general health. And then the focus really should not be on supplements but on food. So generally healthy food intake, and a great distilled version of generally healthy eating is Michael Pollan's quote, "Eat food, not too much, mostly plants." There are lots of specific diets that follow that approach, and then not too much food would be the 4th element in the MS-specific treatment plan. In terms of physical activity, that's something that really should be part of the treatment plan. That's something we address at each clinic visit, and we're generally looking for 3 to 4 sessions per week, 30 to 60 minutes per session, 2-to-1 ratio roughly of aerobic to strengthening, also adding in balance and strength training. And then something that's often left out of kind of type A US-based exercise programs is during the exercise or at the end to just lie on the floor and just relax. That's a great benefit of exercise. It generates relaxation molecules in the body, and why not ride the ride of that relaxation? So I think that's very important to include that, and that's a great way to teach the body how to relax. So that's the physical activity piece. The emotional health piece, I think often emotional health is now distilled down to if you're stressed or not. If you are stressed, then you can do mind-body stress-based programs, relaxation-type programs. I think those are all well and good, and I think those can have beneficial effects, and there are multiple studies of those providing beneficial effects for multiple symptoms of MS. But to distill down our emotional complexity as humans to whether you're stressed or not is far too simplistic. We are much more complex emotionally. So to really kind of get in tune with your emotional self, to identify and process emotions, we're all capable of that, but the American culture, especially for men, certainly does not highly nurture that. So I think the MS diagnosis can actually be a springboard for people to really better understand their emotional health. And I've seen many dramatic examples, especially in men in their 20s, diagnosed with MS with very little emotional awareness, and over time becoming, and this is over a 3 to 5 year time, becoming very emotionally aware people and very much able to identify and process their emotions. So that's the emotional self. With tobacco and alcohol, there's lots of evidence. You know, MS is probably reason 200 to not smoke. So evidence that tobacco smoking increases risk for MS. If you do have MS, increases risk potentially for attacks and progression of disability. On the positive side, there's newer evidence that if you have MS and you smoke, those negative effects I just mentioned can be removed. And that can be seen early on, first 3 to 6 months after stopping smoking, you remove some, and within a couple of years, those negative effects have been essentially removed. In terms of alcohol, certainly high alcohol use would not be recommended. That can produce other medical conditions that could negatively impact MS. In terms of moderate alcohol use, there's actually some evidence, this is not definitive, but there's some evidence that maybe in some situations moderate alcohol might be better than no alcohol. And that's a little parallel with what was seen a few decades ago in terms of heart disease, that moderate alcohol use might actually be more beneficial than abstaining from alcohol. So we don't know exactly in the MS situation specifically now, but certainly if you drink alcohol, moderation or less is recommended. And then the final area is keeping the rest of the body healthy. And this is not new information. There's studies that go back 20 years indicating that if you have MS and then you start developing other medical conditions, and at this point the list is very long. These other medical conditions can be obesity, high blood pressure, high cholesterol, stroke, heart disease, and the list goes on, includes arthritis, lung disease. So if you develop any of those conditions, they can potentially increase level of disability and lower quality of life. And I think that makes sense. It's some of what I'm talking about here seems like common sense, but it doesn't necessarily permeate into the standard of care. So the best way to keep the body healthy is to do these 4 other steps. So addressing diet, exercise, emotional health, tobacco, and alcohol. And then if you do have other medical problems, to make sure those are optimally treated. So as I said, I have patients who have told me spontaneously, I didn't have to talk with them at all. It's sort of a stereotyped way people tell me, and they kind of come in and they sit down quickly in my office, and they won't let me, they don't want me to start the conversation at this particular clinic visit. They'll sit down and say, I'm going to tell you something you're going to find surprising. And I actually know what they're going to say, and what they end up saying, one of 2 things, often both, but some variant of that MS has actually been a gift and it motivated me to improve my lifestyle to the point that I think I'm now healthier maybe than I would have been if I had not been diagnosed with MS. The other aspect of the gift element of MS is that it can motivate people to find meaning and find joy in their life that they couldn't find otherwise, that they were not finding otherwise. So that gift element of MS certainly ties into this integrative care model, and certainly some elements of integrative care, like the food you eat, what kind of movement you do with your body, your emotional health, especially positive emotions. A lot of that ties into kind of what the core of being human is, and what gives us joy and meaning in life ties into this broader approach to MS. So how do you embark on this kind of path with integrative care? First element is to become educated about it. Make sure you're on board with this, because this definitely is collaborative, and some of the primary accountability for some of these approaches is actually with you. So you really need to be on board. Then you need to make sure you have clinicians in your treatment team who are on board. And I will tell you, I've been doing this a long time, and there were very, very, very few 20 years ago, and now there's a growing tide for clinicians in various fields to understand what I'm talking about here and to be on board with that approach. So to conclude, I'd like to go back to that image that I gave at the beginning, back 20 plus years ago in my practice, where I felt like I was in one car, my patients were in another car, and we'd rarely kind of line up together. I must say now, I think for me, and I think for my patients, it feels more like one of those driver's education cars, where I'm at the wheel some of the time, my patients are at the wheel some of the time, but we're kind of in it together, we're in the same car together. And I think that collaborative approach is absolutely essential, and that's a critical element in this integrative care model. And as I've said, some aspects of the care are going to be mainly on the clinician side, but many are actually going to be mainly on the patient side. And then finally, this integrative care model, it does just open this door for kind of leveraging the MS diagnosis, kind of this bad news diagnosis, into something that can potentially overall increase your body health over the long term and add joy and meaning to your life.